right, what's up, YouTube peeps? We got Coach Mitch the Merce on Instagram. If you want to give him a follow, dude does some cool stuff. But we got him in here for a little chiro appointment today. And we are going to be working on full spine adjustment, neck, mid back, low back. We're doing a little scan of his shoulders. Like many people, we have a little bit more right neck, right shoulder dysfunction, just like up in the right upper scapula, the levator scap, the upper trapezius. And we do our scans, what I like to call a scan, just with my thumbs and my hands up on his shoulders. And you'll see us in a lot of the videos checking the glenohumeral movement. The left shoulder moves well, and Mitch's right shoulder is a little stiffer. Feel the difference. That side moves well. This right side a little tighter. But which wrist did you break?
Left.
Left wrist. And you have
right
pins,
dominant.
Right dominant. Do you have?
I have two screws in the wrist.
Okay. 2 screws in the wrist. And what was that accident from?
Boxing.
Like a little boxer's fracture?
Yep.
Yeah. Okay.
And then it healed wrong.
Ugh. So we'll do some wrist stretching. Maybe we'll do a little forearm work on him as well. But really his right upper quadrant. Sometimes we'll see that the right wrist, if it was the right wrist fracture, that can be an issue that causes scar tissue and movement imbalance down into the right wrist and the right elbow. And sometimes it's the left wrist, and then the whole upper quadrant, the left quadrant, the right quadrant just get a little imbalanced. Mitch does a couple different sports. Yoga instructor. A year into jiu-jitsu, CrossFit, go to training, hiking, running, biking. All things activity for this guy. He moves very well. We've been working out together for a while. In between his yoga practice, and you are certified, right?
Correct.
And what's the program you went through, or is it like the
registered yoga teacher, 200 hours.
200 hours. RYT, right?
RYT, yep.
How many years you been doing yoga now?
Like 17.
Dude likes to zen out. Meditation,
breath work.
How important?
Crucial.
For what?
Mental health, mental sanity. It comes into cardiovascular benefits, endocrine benefits, the stress levels, the toxins that are released from high stress. I'm a nurse in the emergency room. We have very stressful situations. So meditation allows a little bit of space between emotion and thought.
This is going to be a good conversation. I'm excited for this. So we have a couple different kinds of medicine. We have allopathic medicine, which is the acute care hospital type setting.
Which you want if you are in a car accident.
Absolutely.
An acute injury, an acute traumatic event. We have a lot of Western advances in medication and surgeries. And that's needed sometimes.
Imaging, all that good stuff, right?
That's right.
And then we've got alternative medicine like homeopathic.
Preventative Eastern medicine.
Yeah, preventative Eastern type medicine. We've got, what's called the CAM, the complementary and alternative medicine. That's where acupuncture, chiropractic, massage fits into play. So you got these body work, Reiki, what else?
Energy work, energy manipulation.
Is yoga considered obviously complementary and alternative?
It's a full system.
So you got go ahead.
No, I was going to say yoga has been targeted to be one specific thing, which is body movement, but it incorporates breath work, it incorporates energy manipulation, it incorporates meditation. It's a whole system of living. But we focus on the body, the physical, the bottom of the triangle, because that's the easiest one to see benefits from and identify with.
The bottom of the triangle, are you talking about the physical, chemical, emotional triangle?
Body, mind, spirit.
Body, mind, spirit. Yeah, so Coach Mitch here, I've had the pleasure of knowing him for like 10 years.
Yep. And
we've done some cool things together. We still got a lot of life left to go to do way more cool things, right? But Mitch has worked in the hospital setting, and we've talked extensively about the amount of stressors, right?
Mm-hmm.
Just
food, radiation, screen time, stress,
immobility,
relationships, It's a holistic picture.
And Mitch transitions from this high stress environment in the ER, the emergency room, and he leaves the emergency room and he does a lot of mind clearing, right?
Mm-hmm.
And energy clearing through his yoga, meditation.
Yeah.
What else? Outdoor environment.
Nature time, hiking in the woods. That's my new church. That's the church that I always went to that I didn't know was a church. Community is crucially important. Having people on your team. Having some type of therapeutic relationship where you can come and vent to somebody and get stuff off your chest. Those stuck emotions manifest themselves in physical ailments. People don't know how to express bad emotions. They don't know how to talk about stuff. They don't get stuff off their chest, so they start to develop this tight chest.
Heavy
chest, heavy body, heavy spirit. So you have to have someone that you can talk to, whether that's a professional or whether that's a friend. You have to be able to express emotions, or else those things are gonna. I mean, there's some research that like emotions being stuck can lead to cancer.
Yeah.
No one still knows what cancer is really, or where it's coming from.
It's a buildup of toxins throughout the body.
Right.
You
If
know,
you stay chronically stressed, you're poisoning your system.
poisoning.
Acute stress is important when you're in a stressful situation to get out, but your whole life shouldn't be structured around stress response.
That constant fight or flight, right?
That's right.
So we've got, the pyramid I like to talk about is the physical, the chemical, and the emotional pyramid, right? And I personally like to think of it as like, you've got your big triangle, right? You've got your emotional health is up top, and then you got your physical and chemical, which are kind of down here in the bottom left and the bottom right quadrants. And emotional stress kind of governs how the physical health and the chemical health is gonna function well. With chiropractic care, we are addressing the physical health. With exercise, we're addressing physical, chemical, and emotional health. And with chiropractic, there's minor crossovers between an adjustment that releases endorphins, the physical aspect of touch feels good for a lot of people. We release, physical ailments like knotted up connective tissue and restricted vertebrae. And then emotionally, as a chiropractor and as a yoga instructor and as an ER nurse, both of us, health provider, we connect emotionally with individuals that sometimes they've got great connections in their own life, and sometimes they're stressed to the max at work, and they might be stressed to the max at home. And so this partnership, which every appointment is a partnership between me and whoever it is that I'm working on, or even Coach Mitch with the clients that he's coaching or the patients that he's seeing, is a therapeutic partnership or a therapeutic relationship. We connect on the emotional level, we connect on the physical level.
And chemical, man.
And chemical
relationships. Right? What is that? What is released whenever you have a loving relationship?
Oxytocin.
That's right.
Oxytocin is your feel-good love hormone, right? And if you've ever just been so happy you get like chills. Flow states. Your vibrational energy is just right on point with whatever activity it is that you're doing.
You ever have a good day and it goes by real fast?
Yes, sir.
You ever have a bad day and it goes by real slow?
It just drags. Yeah. So this is an awesome topic of discussion, but super important internally and mindfully. You guys acknowledge your stressors. Whether Mitch, we talk a lot about his work and just the accidents and the acute injuries that he sees, and he's on. You know what I mean? When you're on at your job and you're just going and you're working hard, and you've got to heal this person or help this person.
I have no choice but to be in the moment. So if I'm thinking about the stress at home or something, I am not going to be providing the best type of care. So it's crucially important for me to provide good care, to be able to step aside from the stressors that I'm dealing with in my life and the stressors that are happening in the moment.
And I don't know what the term is, but I like to call it like an energy shield, like your force field. Your aura. We have this
force
aura,
field,
but we need to learn how to put up the block, the wall. Okay. For the first like 5-6 years when I was in practice, some patients come in and they give you energy. They're very energy promoting. They're energy producing. They're going to give you that good vibe. You're going to leave them. You're going to feel good. And then other people, are energy vampires or energy suckers, and they're going to talk to you, and you're going to leave there and you're going to feel exhausted. The way I am, I'm kind of a Gemini, so I go both ways. Sometimes I'm really energetic, and other times I'm like, I need your help, Mitch. And Mitch will kind of counsel me and guide me a little bit, and he gives me energy when I need it, and hopefully I give some to him when he needs it.
Energy cannot be created or destroyed.
It's just passed back and
along.
forth. It's just migrated back and forth. So, back to chiro, what we're doing, just doing a little muscle work, a little myofascial release up on Mitch's cervical extensors, his upper trapezius. He's got just a little bit of junk or congestion or muscle fibrosis, just irritation. A little more so on the right shoulder, but definitely a little bit up here in this upper left suboccipital region.
You can feel it.
And yoga and flexibility and stretching, as you see on some of the other videos, mega important. You got to move your body the right way every day, and you gotta, you gotta stretch. That's the one thing that's super important. You got to hold your posture correctly.
Holding your posture correctly is a cheat code in stretching. If you can just move correctly throughout the day, you don't have to stretch.
True story. True story. You can stretch less, right?
Stretch less.
Stretch less. Move better, more.
Move
stretch
better,
less.
more. Yeah, that's right.
I still love stretching though.
100%.
Good stuff. All right, let's go face down for a minute. All right. So we're going to start with just a little hypervolt around the hips. We commonly treat the, the iliac crest, the glute medius, the glute minimus, the IT band, the SI joints right around the hips. And lots of people just develop a little tension, a little tendonitis, a little irritation around here. This helps stimulate the base of the spine, the cauda equina, the lower spinal cord. You can feel this movement kind of like straight through your pelvis, right?
Mm-hmm.
Especially when we get right on the SI joints. Mm-hmm. The hypervolt and vibration therapy down to the lower body, the lower abdomen, or the lower back, and even the sacrum. This stuff I've found really helps the colon, the lower digestive tract, and it just feels so good to release stress in the sacrum, in the pelvis, and down in the lower body. So we do pretty much on 100% of clients that we work on in the office here. We're going to just treat a couple minutes around the pelvis, around the hips, to improve circulation, help eliminate or reduce some of the muscle tension that's present, and just provide some good sensory input into the nervous system and into the body. Now, Mitch knows a lot more than I do about the chakras. And what's down here? Your root chakra.
Root chakra. The Muladhara.
Say it again.
Muladhara. Muladhara.
What else can you tell us about it?
The root chakra grounds you. It takes care of all your basic functions. It's our animal behavior. It's what we need to survive. You gotta stay rooted. But then, again, the concept of the tree of life, your branches can only grow as high as your roots grow down. So you have to have some type of grounding practice, some type of rooting system, and that's what our base chakra is. That sits right at the base of the perineum. That's when you sit in a meditative seat. That's what's touching the floor.
And you're grounding then, right?
That's right.
Now, what I've kind of, sensed in my own body with barefoot training, that's also a good way to ground, right?
That's right. Walking around in nature. I don't know the specifics of it, but there's some ion exchange thing that's happening with the energetics and the vibration of the earth to the naked skin on the bottom of the foot. It's important to walk around on grass. It's called grounding, but you just walk around barefoot in nature, and it helps re-ground you to the elements. I mean, if our body's made of 5 elements, and if we can connect and create the right balance of that elemental relationship, just like the earth has, that's all we're trying to do.
Push.
Get in tune with the cycles of nature, and your
Push.
body will heal itself.
That's awesome. Push.
Earth, water, fire, wind, ether.
Push. Earth, water, fire, wind, ether. Stop. Good.
Yeah, I think your body's 72% water, 7% earth. Digestion is what's considered the fire because it's the fire to break food down.
Push.
Stop. Air and wind is your lungs.
Push.
And then the empty space is the ether. So there's that relationship of all these
Push.
elements. Whenever there's an imbalance, that's where sickness manifests from.
Stop. Good. Relax. Sickness, illness from imbalance in those three stressors: physical, chemical, emotional stressors. And good. All right. Let's do a little muscle work in Mitch's low back. Hit lumbar erectors and kind of flow right up into the thoracic erectors. We talk about the erectors or the paraspinals. Paraspinals are these big muscles that run up and down the spine. Mitch works out a bunch. He does some weightlifting, some yoga, some CrossFit, some Goda training, some interval training, some jiu-jitsu. So this is a dude that's in tune with his body, and it shows. He builds good muscle, and he's got very minimal sticky spots through the spine. He's got a little bit of tension down here in the low back, and a little bit right here in the right shoulder. Not too bad though. But one of the things you guys might notice that are watching this is he's got really good tone. His low back tone, the tone of the muscles, is kind of like what we say, soft and supple. It's pretty malleable. So a lot of the times, shout out Deza. He just had a nice massage with
Deza Pastor.
Deza Pastor. Maybe we'll get her on the YouTube channel here. But Coach Mitch, when we talk about the suppleness of the muscles, we want the muscles to be strong, but we want them to be soft and flexible. And if you've got a really chronically tight low back and your low back muscles, like so many people will come in here and these muscles will just feel like steel bands because they're so tight.
And that tightness doesn't equate to strength, correct?
Nope, not at all. Tightness, does commonly equate to pain or injury. But lots of people, they do lift a lot of heavy weight and they get these big tight muscles, which ultimately will develop injury at some point. So we want to be calm. We want to be parasympathetic. We want to be rest and digest. Rest and digest is calm. Mitch practices a lot of diaphragmatic breathing, a lot of yoga on top of his high intensity, interval training, his heavy weightlifting and everything like that. So Mitch knows how to switch between his fight or flight nervous system when he's at work in the hospital or he's getting a heavy workout, and then he can bring it all back into balance with the rest and digest and the parasympathetic nervous system.
There's good stress and bad stress.
Yes, sir. Good work. Good stress and bad stress. We want to stress the body in good ways. We want to try to eliminate the bad stress as best we can. We can't always eliminate bad stress because
shit happens.
Our family stresses us out. Sometimes work stresses us out. Sometimes some guy driving down the road will stress you out, right? And then what do you got to say?
You got to write something on your keyboard.
Keyboard warrior. Don't go to Facebook and post, this guy cut me off. I'm so angry. Breathe it in. Breathe it out. Let it go. Let that stress just leave your body. Don't harbor on anything. Don't harp on anything. Don't hold anything. Arms down. Deep inhale. Deep exhale. Good. Good. Deep inhale. Deep exhale. There goes one. Good. Deep inhale. And deep exhale. Good. Now one more in. And out. All right. All right, we're going to do left right here. Good. Little one right here. All right.
Oh.
Good. All right, face over to the window, right side up for me. Now Mitch is he's pretty mobile as a musculoskeletal system. Head up for me nice and high. Exhale out. Good. Other side for me. And so we get some real easy adjustments. Scooch towards me right here. Ball leg straight, like this. And then head up. Good. Exhale. Good. Flattening back. All right, brother.
Oh man, that left foot's tight.
Yeah. Relax. There goes the cuboid. So Mitch definitely has to work on one of my favorite things, which are those go-to-feet exercises. Bro's got to get a lot of strength. Feel how tight that stuff is today? Why is that?
I don't know.
Huh?
Always.
Always is?
Well, I don't know.
I'm going to show you guys something crazy after this, which is amazing. But Mitch definitely has some jammed up metatarsals. And we got to work on his big toe, second and third toe flexibility right here. Was this your jammed up knee from a while ago?
Yep.
All right. So we're going to walk Mitch through a nice little exercise right in the doorway here after we're done. Definitely a lot easier on the right foot.
Mm-hmm.
And one of the things we like to check is that, that big toe flexion and 4 little toe flexions. We want to see that the toes can curl under, making almost like a fist like this. Most people, lots of people, foot fists, yeah. Most people have, shin splints. You get shin splints down the lateral legs. You can get peroneal tendonitis, ankle tenosynovitis, just like different pains down the foot. And definitely this left foot's just a little stiffer. His big toe's a little stiffer. So I can apply a little overpressure through the top of his foot to start stretching out some of the connective tissue on the top. But we really need to just work with Mitch on developing a little more big toe flexion. And this side is just so much less restricted. Okay. Scooch up a little bit for me. Right there. Whoa, scooch up a little more for me. So we just got a nice little ankle adjustment. We do what's called a P to A, an A to P tibia adjustment just to get his ankles to set back a little bit. But we're definitely going to work on Coach Mitch today with some mega foot flexion so he can increase his ankle plantar flexion. We want to get these ankles to be a little more flexible. He's got some tension going up the outside of his leg right here, and probably, do you have any burning, any pulling tension?
Not too much, but I got a lot of inflammation in my ankles and scar tissue, which restricts some motion.
Twist your knees open for me, like that. And you can probably feel
that left foot's
tight. Yeah. Twist the right knee open. Now, both of your feet, I definitely want to work on the next month or 2 months. To really help you get better extension, better plantar flexion down through the feet here. Okay, bend up here. And that's good. Bend up here. All right, let's see right hand. Some of this stuff gets a little sore, guys. And a lot of times, or some of the times, we don't get joints to adjust well because there's just a little too much connective tissue tension or fibrosis. Now, we definitely feel in this left arm, the external rotation, which is the outward movement of the thumb, is just a little stiffer. Let's see if we can get this elbow today. That's all right. So, just like that.
Elbow straight.
Yep. Now bend your elbow into my hand. Now stop. Now bend. Bro, you want to zoom up right here? Bend, 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 bend. See that little fasciculation right here? You feel that thing work right there?
Mm-hmm.
Twist out a little more for me. Bend your elbow. All right. So keep going. Keep going. Keep going. Boom. Keep going. Bend, bend, bend. Pull, pull, pull. And then relax. You okay with this power down here? That's tight though, huh? So because of Mitch's left wrist surgery, he's got some just fibrosis down here in the wrist, down in the thumb. His radius and ulna, they just don't externally rotate well. So for us to really heal Mitch's elbow and wrist and shoulder and neck, bend your elbow for me. Mitch is going to work on a doorway press. Come on, keep going a little more. And you guys can see how we are stimulating. Can you see those little muscle fasciculations? We're stimulating this bicep and this longer front chain of muscle, the bicep, the forearm flexor, to really get active in a lengthened position. We want to get that left side nice and strong. So Mitch will be doing that as an exercise. All right, easy on the left. One more on this right shoulder down. All right, guys. Sit up tall for me. Last step. Last step, last step. Is going to be, now shoulders already looser. Feel that guy right there.
Mm-hmm.
And this guy, let's do a little bit. Relax for me. Right here.
Mm. Mm.
Now, Mitch's finish. Put your hands back on your hips for me. Back here on your bum. Fingertips down. Nope. Palms into your bum. Like that right there. Hands right here. So Mitch's finish, guys. Do you mind if I lift up your shirt? Can you come back here and look? We don't have to take it off, but just put your hands right back on your hips. Right there. I'll sit up tall. So Mitch's finish that he knows he's got to work on over in the gym with some rehab stuff. We've got to get him to build a ton of lat, mid-back, mid-trap, rhomboid, serratus musculature. And we got to eliminate these wing scapula. So for us to heal and improve Mitch's movement, get him a little stronger. Go ahead, put that down. Good. Put your hands back on your hips. Mitch is going to spend some time in the great outdoors today. You hiking a little bit or no?
I got to work night shift tonight, so I won't be hiking too much today.
So he does like hiking, so we'll say, hey, if you're out in the woods or if you're walking around the hospital maybe, I want you to just set your hands on your hips for maybe 10 or 20 or 30 or 40 steps. And we want you to just work on a nice power pack with the shoulders. And the power pack is a hand press into the hip and a gentle shoulder depression down and in. Focus on the right hand, lower this right shoulder down, and then focus on your left hand, lower your left shoulder down. And he's going to really feel these lat muscles just light up right through here. And he's got a little more work to do on the right side to really find that right shoulder pack, which is that right there. Okay?
Mm-hmm.
All right, cool. Stand up. Let's do one more rehab exercise because I want to show you guys the capability out of the human body for ankle and knee strength. So you guys see a lot of the videos on the YouTube channel about how important hanging is. And one of the things I started doing a while ago, probably about 6 months to a year ago, is working on my plantar flexion of the ankle and the foot and the big toes, the little toes. We can use a pull-up bar to get assisted, kind of pulling the elbows in nice and high, and starting to work on bending down on the tops of the feet. Our weight is balanced through our arms and our shoulders, and we can start to work on really getting into some full extension of the knees and balancing right up on the toes, okay? Now, as your feet get stronger, we start to work on reducing or removing the hands from the pull-up bar, and we're gonna work sitting down gently on the tops of our toes like this. And we're going to start to work on some hip swiveling. You just heard my hip adjust right there. And ultimately, we're going to work down into a nice tight squat position while we're on the toes like this. As we develop the strength in the lower extremity and the connective tissue strength, we just heal our musculoskeletal system. The bones get strong, the joints get strong, the connective tissue gets mega strong. So let's try this out. I think we've done this before, right?
We have, yes.
Have you practiced it in a while?
Mm-mm.
All right. Now, So Mitch is going to start off, and we're just going to have him hang right here. And he's going to work on gently a little bit of pressure down through the feet. So he's going to push down. Or we're going to come up high on the toes. Awesome. Raise those heels up mega high for me like that. How's that feel through the feet? Pretty nice.
Tight and nice.
Can you squat down halfway while you hold on? And now I said, and he's got some more pain on the left foot.
Mm-hmm.
So we want to kind of transition between the little toes and then over to the big toes like that. And really try to get this top knuckle down on the ground. And that's just going to help us stretch out this anterior compartment of the left ankle and the right ankle. All right. Stand up tall. All right. You think you got the ability to weight those toes or not yet?
No, I don't think yet.
Not yet.
Nope.
Cramping?
Not today.
Not today. Okay, good. All right, so Mitch is going to work on this exercise under a pull-up bar for maybe 5 minutes a day. And you can work on one foot, curling the toes over or under. You can work on the outside of the foot, the big toe. We can start to just assist the arms and the leg and just start to work on that single leg flexion. But this is going to help his feet bones big time and his ankles develop some beautiful stability. That ultimately will help his knees and his hips and the front chain to elongate and the back chain get stronger. Okay? We'll see you guys later. Follow YouTube for more videos.